Like, we sold our house.
Right.
We were packing up. There was some tears and stuff like that.
And some doubts. It was not the path that I thought was predetermined for me in life, right? So it was something different. But I'm always open-minded. And like I said before, it was a unique opportunity to make a difference. And I thought it's either now or never. And I was here and I started working on the program. I never had doubts. In my mind, failure was not an option. I knew the strengths we had. I knew the impact that we could make. And I knew the team that we had built. Welcome to another episode of Brain Buzz, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
Well, Jason, here's another episode. So, guys, we've been talking a lot about several diseases that we treat at the Stroke and Brain Aneurysm Center of Long Island, and we've been giving you tips and advice about your brain health, but we've been getting a lot of questions from you about how we got here and how we built this center and why we built it on Long Island, and so we thought today would be a little different and talk a little bit about that process. Right, Jay?
Yeah. It was definitely an interesting process, and a lot of people, from a business aspect to a patient care aspect to a geography aspect, there's a lot of questions that come to be. So,
how on earth did we get here?
Well, it starts with you, right?
Well, yeah, I guess. So I'm a neurosurgeon, like you guys know. I trained in neurosurgery at Dartmouth in New Hampshire, and as I was finishing up, of course, I wanted to do vascular neurosurgery, neurointervention, which is the principle where we treat strokes, brain aneurysms, arteriovenous malformations, anything really that has to do with blood vessels in the brain and the spine. And, as I was finishing up, I got a fellowship in, I think, one of the most prestigious hospitals for a fellowship in neurovascular neurosurgery for stroke care. Mm-hmm. And that was at Thomas Jefferson University Hospital in Philadelphia. And I met you there.
Yeah, that was my home for a long time.
And so Jason was running the department there from a radiation technology standpoint, and he'll tell you a little bit about what he was doing there, but I was always looking into building something that would make an impact in the community, right? And as I was looking for jobs across the country, I had several opportunities to continue an mainly academic-focused career, which was actually what I thought I would be doing. I never thought I would be starting a program and I would be in the trenches of building something from the ground up, right? But I'd published a lot in residency. I'd published over 120 papers. I had NIH funding. I had a lot of support, and I really thought that would be my path. But I got a phone call from an old friend that we did our residency together, and he said, "Hey, I'm practicing down on Long Island, and we're looking into building a program in neurointervention, which is what you will be doing, but we don't have anybody to run it. And so would you be interested in coming down and taking a look?" So I did, open-minded, of course, slightly before signing up for academic positions. And when I came here, what I realized was the big void in the community. So Suffolk County, where this program is established, is over 1.7 million people, and there was really no comprehensive way to treat stroke and brain aneurysms and cerebrovascular disease. There were hospitals far away from the South Shore of Long Island where we established the program that really offered the service, but there was no neurointensive care unit in this area. All the components were not in one place together. So I thought it was a phenomenal opportunity to make an impact. And as they say in business, fail early. So I was thinking, what, if I fail, at least I'm still young and I can take a job somewhere else if it doesn't work out. But like and we've said multiple times, for us, really failure was never really an option. We went all in. And so one of the things that I needed to do coming to a place and building a program, obviously it's a very daunting task because you're surrounded by a hospital that's foreign to you. You're bringing a principle that people don't really know or appreciate much, and you kind of have to change the culture. And you can never do it by yourself. The the thought of a lone wolf changing the world is really a myth. You need a team, and the power of the team is really what makes a difference. And one of the most important people in that team was somebody that knew how to build the neurointerventional suite, which is for those of you guys who maybe are new to our channel, that's the special operating room where we do these procedures to treat strokes and brain aneurysms. And that area is heavy in technology, and it requires several regulatory aspects to be up to date. And so there was no better person in the world, in my humble opinion, than Jason to do that. But Jason had a job in Philadelphia, and a good job, and he had a family. He still has the same family, by the way. I don't know why I used past tense on that.
I left them all.
He has a family, but at the time they were all in Philadelphia. He had a young son who was in school, and so he was kind of one of those situations where it would be impossible to get him to come. But I used my power of conviction. And I think maybe you saw my passion and how I was certain that this was going to work. And maybe I'll let you speak about that. And then I kind of convinced them to come over and join me in this journey. And I guess this is a good point to have you tell us a little bit about how you came to come down here and built this.
Yeah, kicking and screaming. I was very fortunate with a lot of the fellows. Very talented people came through, and I became friendly with a lot of them, and a lot of people had asked if I would ever be interested in leaving, but it was very much across the country, or far northeast area,
right,
or south area, so farther away from family. That would have been ideal. And my wife has a bigger family, so that's where it really lies in. And as we know, in any marriage, the wife is the one that makes the decisions.
That's right.
So you had asked me, and of course I went home and I said, this is, what do you think? And so that sounds great, but we live here.
Right.
And then one day she was at work and kind of looking around at the same four walls around her, even though she did a lot there. She ran 3 GYN offices at the time, and she said maybe it is time for a change. And like I said, the wives make the decisions. So that's how we end up here. But one thing that did interest me the most, and got me to kind of start the conversation at home, is how you said there was a hole in the care here.
Right.
There was literally a hole in the ground.
That's right.
And you had come to me and said, we're going to build a program from the ground up and do it the way that we want to do it.
Right.
And I don't know that the opportunity would ever come around again.
Right. Neither for you nor for me. So neurointervention, guys, is a field that really started to take off about 7 years ago, which is kind of around the same time we started building this program.
I've seen devices start from abysmal to phenomenal where we're at now.
Right,
So
and then
really
clinical trials and everything
Yeah.
else. But especially when it comes to stroke, the first clinical trials that really showed us that we can make a difference happened about 7 years ago or a little more.
Mm-hmm.
And even when I did my fellowship, there were the very good fellowships in the country were very limited. And so now, of course, the field has exploded. But at the time, the way I saw it is if I joined an academic program and kind of was the number 2, number 3 guy, I would never have had the opportunity to build something from the ground up, do it the way I wanted, make a difference in the community. And then 5 years later, 7 years later, it would be too late. Everybody would have established programs by then. And so that's kind of how it was now or never moment. And we kind of jumped in both feet. And
it's the only way to do it, though. I mean,
right.
you hear stories. If you have 1 foot out or 1 foot in, I mean,
you're out.
Like we sold our house.
Right.
In Philadelphia, and I mean it was definitely hard. It was, when we were the last day when we were packing up, there was some tears and stuff like that,
and some doubts.
I mean, the doubts kind of lasted for a little bit,
right.
Because you hit those highs and lows, and I'm sure you're going to have some stories of your own where
right.
it's like, was this the right decision, or from either personal or professional standpoint?
Yeah, you're absolutely right. I mean, for me, it was not the path that I thought was predetermined for me in life, right? So it was something different, but I'm always open-minded. And like I said before, it was a unique opportunity to make a difference, and I thought it's either now or never. If while I was being here, when I was here and I started working on the program, I never had doubts. in my mind, failure was not an option. I knew the strengths we had. I knew the impact that we could make, and I knew the team that we had built. Because at the time, of course, you came in and helped me tremendously on the neurointerventional side, on the room side, but then, we also brought other key folks. We brought a nurse practitioner with us who then was helping me with establishing clinical protocols.
Me and her found ourselves in so many administrative meetings,
right,
that we didn't know that we were ever going to do.
Right.
And we really leaned on each other in that beginning.
Right. And kind of building a program, right, for those of you guys that are wondering what it takes, right, it's not just you show up and start doing procedures. That's not going to work out. We had to establish protocols. We had to anything from nursing care protocols all the way to order sets for the care of these patients, right, to post-operative care, to clinical pathways, to a lot of different things. And then that's one component is intervention, right? Materials, supplies, determining pricing, being part of the supply chain and helping the supply chain of this institution figure things out.
And getting all this new technology,
new devices, right? And then creating a neuro-ICU. There was no neuro-ICU. As a matter of fact, I remember very clearly when I first came to see the hospital, administration, so the chief medical officer and the CEO of the hospital, their offices were in what would be eventually the neuro-ICU. They were still there. And so we had to move them out of the way and demolish that space and build a neuro-ICU. And building the neuro-ICU was another daunting task. And 65 new employees, new nurses, trained new nurses, a lot of whom really were extremely talented and eventually became nurse practitioners. Some stayed with us and some moved on to different jobs. And we're very, very proud of that impact that we've had. That was also very challenging. And again, it's the power of the team. We were very lucky. We've had Dr. Ahmad in our podcast in the past, and he was a key component in building that unit together with us. And then the nursing educator for that unit was Karen Antaki, who came to us with a lot of experience at the time, also a key component of the team. She eventually became our stroke coordinator, another key person.
She was a cornerstone. I don't know that we would have got comprehensive as fast as we did without her.
Absolutely not. So we needed to get some people in key positions very, very quickly. So I think kind of to sum it up, the way it started is we brought a core team of people, and of course, I almost forgot the other person that was really instrumental in a lot of aspects was my wife. So my wife's a nurse practitioner. She was with me in Philadelphia. She came with me here and gracefully agreed to be part of the advanced practice providers in the neuro-ICU when we started. And so she brought that neuro knowledge and helped train all the other APPs that then we would bring onto the unit. And of course, she was instrumental in maintaining my sanity because I was on call 24/7. So she balanced me both at work and outside of work. And frequently people say, how on earth do you work with your wife on a daily basis and then go home and still like each other? But we never had an issue, and we enjoy being together. It doesn't matter in what setting. And so we had these key people initially, right? So we came on board, identified the deficiencies, and there were many, and then brought the key people on board, and then created a culture among the key people that was very strong and very dedicated, and that culture then permeated the institution. Because if you think about it, stroke is not a disease that happens only in the emergency room, only the neuro-ICU, or in one part of the hospital. This is a 537-bed hospital. It is across the board. And stroke needs to be understood by everybody in the hospital. So we had to change the protocols in the emergency room. We had to change the protocols inside the hospital. We had to change the mentality and the thought process in the hospital, right? So you're dealing with a hospital where a lot of physicians are maybe voluntary, private doctors that bring their patients to the hospital. And so how do you get an opportunity to educate everybody? Not everybody's there all the time, right? And so that was a lot of work by all of us, and constant work, and the same work again and again and again. And that can be taxing. You do the same thing. But I guess that's the benefit of starting something when you're younger of that nature, because you have the passion that's unbounded, and you're not burnt out. You have the energy, and you're not burnt out. You're passionate, and to some extent delusional about life, and you carry that energy with you, and you convince people to go the extra mile. And of course, I want to say I'm very appreciative of the treatment that we've had from administration in the hospital. We really, of course, initially folks didn't understand exactly what we were doing, right? And if anything, they tried to understand. They understood it. They supported it. Mm-hmm. And I would say today, neurointervention and the Stroke and Brain Aneurysm Center of Long Island is one of the, if not the flagship program of Good Samaritan University Hospital.
For sure.
And it's, above and beyond its impact to the community, it really has changed the culture of the hospital. Somebody shows up in the emergency room today with any sort of problem, I bet you the first thing these folks think is this a stroke? Should we activate the appropriate protocols, or should we move on to something else, right? And because they understand the value of time in stroke. I mean, if I had $1 for every time I said time is brain, mm-hmm. I don't think I would need to practice anymore, And to this point, even administrators that normally are not medically related, like our chief operating officer, whose background is in the military, actually, whenever he sees me, he says, time is brain. I bet you he can read a CT perfusion if I ask him to.
Well, he's been to enough of the talks.
Exactly. But yeah, so this was kind of the beginning, right? The beginning was, what do we need to do here, and do we have a good team? One of the challenges, like you said before, there was a hole in the ground. So the infrastructure wasn't there. Mm-hmm. There was no biplane machine. There was no physical plant for neuro-ICU. There were plans of where to put these things, but...
Oh, no. I remember on one of my initial interviews, we were at a meeting. I didn't know anybody there. You barely knew anybody there. And I was looking at the blueprints, and I just happened to lean over to you, and I said, I think the door's on the wrong side of the room.
Right.
And I said, look, even if I don't take this job, I said, I have to make this recommendation.
Right.
And somebody there who was higher up said, that's great. We can take that recommendation, but we have to make sure, because there was a pillar in the room that we couldn't move.
Right.
And we have to make
structural pillar for the hospital, so we would collapse the hospital.
But they said, if you can't bring a stretcher through, and we move that door, then it's going to be a huge problem.
Right.
And they used I guess there was an elevator somewhere in the hospital in the past that somebody didn't do something with, and they said that person's no longer with us. So just remember that. Yeah,
because I believe what happened in the past was the size of the door was not appropriate, and then they opened the program, and then they couldn't put the stretcher through.
Yeah, so they had to take all the beds to another place or something before.
Right,
yeah,
right.
So that was kind of the first encounter. I'm making a decision here.
Right.
That could end me before I even started.
Exactly right. Yeah, so that's very important, right? So we have to understand kind of the challenges that we faced. And I guess the faith that was put on us to start this program. And so like I said, the approach to this is multifaceted. You have to have, like I said, a strong team. You have to change the culture of the hospital. You have to make sure the infrastructure is appropriate. And then you have to change the culture of the community. Because stroke is, of course, a community disease. It starts when somebody identifies the signs and symptoms of stroke. It starts when a primary care doctor is sending you somebody with carotid disease to prevent a stroke. It starts when somebody's sending you a brain aneurysm. And those referral patterns didn't exist, right? Mm-hmm. So if you focus on any of these principles without doing all at the same time, you can be dead in the water before you even start the program. We could have put all our energy into a beautiful building and establish no relationships with the community, open our doors, and then look at each other all day.
Yeah.
So it was really important that we pushed hard on every single aspect. I've been anywhere and everywhere. I was talking with the president of the hospital recently, and she made a comment that starting this program, it was no different than running for office for me, because I went everywhere, from community meetings to town halls, to Chamber of Commerce meetings, to anything you can imagine, things that you wouldn't think would make an impact, but actually they did. And if not, right now you're in the South Shore of Long Island with one of the problems we treat, I bet you our name is going to come up at the top. And the reason for that is all that hard work that we put in, and of course the follow-through with good patient care. But that initial push had to be very significant. And frankly, in a lot of these, you followed me gracefully.
Oh yeah, no, I mean,
and painfully, I'm sure for you, but for me.
Well, a lot of the hospital refers to us as Batman and Robin because we were always together, always doing stuff.
Right.
The nurse practitioner was with us in the beginning. Would come with us as well to educate anybody we could. You had said, I think you said it best. We were not thinking about failure, but we didn't have time.
Right.
Honestly, for me, it never came. I was so busy.
Right.
I mean, I didn't watch TV for when the time I officially signed on, from starting to get everything ready. I ended. I think the following summer after we opened, when Game of Thrones came back on, is when I officially started getting back into watching some kind of television.
Wow.
Before it got crappy, but
so that's a very good point you're making, right? So what was our life when we started this program? So when we started this program, and that's for anything, that any new venture, any new business that you start, it's a substantial commitment. It's like a child, you got to give it your all. Mm-hmm. And of course, that doesn't mean that your whole life is going to be governed by this. If you do it right, you will build the infrastructure for a self-sustaining organism. Mm-hmm. But when we started, I was by myself on the clinical side, right? On the interventional side, there was nobody else. And so I had to take call 24/7. And
same, actually.
Exactly.
I was by myself.
Right. And it took what? For me, it took, maybe I was the longest one not to have backup. It took maybe 2 years to have somebody come in and help me. Dr. Misios, who we had in a previous episode of the podcast, he came in and joined me on the interventional side. But for the first 2 years, I was taking call 24/7, and you were taking call with me. Mm-hmm. And you can imagine, guys. Stroke happens at any time, day, night, holidays, weekends. We frequently, we'd be together on a holiday and leave the holiday table and our wives and then go in.
I remember the first Thanksgiving.
Right.
We got to barely gobble down dessert, no pun intended, and then we had to run to the hospital for an emergency case.
Right. And kind of that comes to show you that you need that level of dedication, right? And the buy-in for us for that program was, of course, it was the pride that we built something. We need to see it through. We need this thing to succeed. And so, yes, failure was not an option. When somebody's available 24/7, I joke that everybody on Long Island has my cell phone number, probably because they do.
I was very timid about giving it out at first, and now it's just like, here, take it.
Yeah, and they're not afraid to.
Bathroom wall if I have to.
They're not afraid to use it either. But no, you want to be available. You want to be available. People want to know that you're there. This is a disease that's time sensitive. They don't want to have to make multiple phone calls. They don't want to struggle, especially with if they don't know something about this disease. It's outside their scope of practice. They want to get that patient to you as quickly as possible.
You streamlined everything initially, which I think helped make it extremely easy for everybody. They didn't have to call 3 people. They didn't have to worry about whatever. They called you up directly, which is not the norm by no means for attending.
Right.
And then everything was taken care of. By everything was taken care of, it was me and the nurse practitioner or whatever like that.
Right.
But it was a team approach. But
and that's what
that
I
initial
say.
phone call was you.
Right, but that's
all
what I say.
Of
course, but that's the value of the team, right? Because I wouldn't be able to perform the way I did had I not have had the support from you guys. And of course, then, you guys needed to do a lot of training, train even nurses in the angio suite, right? You're not a nurse, but you had to train them in the workflow and everything else. Even remember, you even had to change the EMR to integrate a new system to register the procedures that we do automatically. Yeah. So much so that when the Joint Commission came to Good Samaritan Hospital, and the Joint Commission is kind of the organization that nationally certifies in this case, stroke centers, they were so impressed. They took a lot of the things we had done as best practices to disseminate across the country. And that
I think that was validation that we were doing
fantastic.
And that was and the right thing.
That was entirely your work. And so, like I said, we did all these things at the beginning, right? Changed the culture, built the program, literally built the program from the ground up, changed the culture in the community, train and educate people. Now, after you've done that, it's my word that we're a great place, but then you need external validation. And external validation needed to come early, again, so that we don't fail. The first 2 years, I would say, was a constant battle to get ahead to prevent failure. Although we never thought of failure, that was
always chasing us, we felt.
That was what was always chasing us. And that external validation in stroke comes from one place, and that is the Joint Commission. The Joint Commission is a national organization. They certify hospitals, they certify centers, and they have several grades of expertise when it comes to stroke. Top one being a comprehensive stroke center. Now, when it came to the hospital that we joined, they were not even a primary stroke center, which is the absolutely bottom level certification from the Joint Commission. They were not.
Which I kind of think overall, looking back in retrospect,
right,
probably helped us because they didn't have bad practices.
Right.
They had no practices.
Exactly.
Which is good because now it's like, this is where you're going to do it. Okay.
Right. So what we did, we said, well, we're not going to go and get certified as a primary stroke center. We're going to go straight to a comprehensive stroke center.
Yeah. Going from 0 to 60.
Yeah, and actually I remember the Joint Commission said, well, we've never really seen that done before, but sure, you guys want to do that, be our guest. And so what happened is we worked hard together with, of course, our stroke coordinator, our quality team, to really build the benchmarks across the hospital that would indicate that we are a comprehensive stroke center. And the Joint Commission came. There's 2 surveyors typically. They come in for 2 days, and they go through all your records. They make sure that you're up to national standards and exceeding them. And they look at your goals, your research, your education, a tremendous breadth of information that they have to share and look into. And they did, and I remember the survey was better than I think anybody would have expected, right?
Oh, especially for the initial one? Yeah,
they
said it was one of the lowest. They're always going to find minor, little things, like things that they can recommend that you do better. And there was not a lot. And,
there was not a lot to recommend, and they praised us quite a lot. And I remember it was a very emotional moment when the Joint Commission told us that we will be a comprehensive stroke center, not just, of course, between me and Jason, who were under a lot of stress and tension to get it done.
I remember Karen cried.
Everybody cried.
I think happy tears.
Yeah.
Maybe a little bit of both.
But also our administration was very emotional. And their participation was kind of on the side and supportive, but they bought in this thing, and I was very appreciative. It was all a big family, and kind of there was, I guess, no other option, but we made it happen. And then from that point on, then you hit the road running. You have your external validation, you're changing the culture across the board. Then all you need to do is deliver consistently good outcomes. Again and again and again, and I think we did. Yeah. There's not a single brain aneurysm case that's been turned away, or a single neurovascular case that would be turned away from our center. We built relationships with other services that are supportive for stroke care, like cardiology. We grew cardiology through procedures that they were not doing before because they didn't have the stroke volume. Now they started doing that with vascular surgery, with primary care doctors, with neurology, a phenomenal neurology group that Laura Donnarumma started when she came to Good Samaritan Hospital. And, really, really integrate all these principles, and so bring that all in together. And actually, how quickly did we become a comprehensive stroke center? Just so that folks...
So I was kind of thinking about it because we opened in September 13th of 2017.
Right.
It was our first case, I remember, because...
Right.
you would have thought it was like the launch of the space shuttle. In the room, all administration was there, all wearing the proper bunny suits and stuff like that.
Right.
And it was kind of like from Jurassic Park. Hold on to your butts. We're hitting the switch. We're doing this. And then from September, I think we applied in April. Is when we had as I remember, a quality meeting when they were talking about pushing the button.
Right.
And they're like, once we push this button, we can't unpush this button.
It was at the beginning of the year, the application went in. Yeah.
Which was kind of insane because, then it takes a process for them to come out and do, they do a kind of initial survey with you and make sir that you're even ready for the big league, so to speak.
Right. I still have that picture in...
It's in the 5-year video that we have on the channel.
So I still have that picture from our first meeting for a comprehensive stroke center. It's the tiniest room that exists, I bet, in the world.
It was so hot in there.
And no air conditioning, of course. Why would there be? And it's probably 30 of us in there with, packets of paper trying to figure out how to get it done. But, it didn't really bother us. And I think that culture that we gave to the place was a culture of success.
Yeah.
And we were not there to lose. This was the best place for neurointervention on Long Island, and we're going to show the world it was. Yeah. And we did it. And that's very important.
I think earlier, though, when you said after you become comprehensive, that's all you have to do is deliver care, because I'm going to call it out. You're lying, because we still do a lot of the practices that we do from the beginning.
Right.
Meaning, we still go to EMS houses and educate. We still, we're still evolving patient education or provider education consistently. I mean, that's how we got to this point of even having this podcast, because we thought it would be another way to educate the masses. And that's the only reason that you got me to sign on to be on this side of things as opposed to in the background, which is where I like to be.
Right. No, I get it. But see, you're right. It's not just delivering care. You always need to stay on top of keeping everybody educated and, of course, engaging the community. The podcast, you're right. We always reinvent ourselves, and that's the beauty of what we do, and that's the beauty of having motivated people that built a program and they're looking for new ways to change the community. Because to some extent, entrepreneurship is a disease you cannot get rid of, right? So we came in, we got our high, we built the program, but it's not over for us because we always want to make a difference, right? And
you keep me busy.
and so the podcast and our YouTube channel was a way for us to take that education that we're doing at a small scale, just for a few hundreds of thousands of people on Long Island, and bring it to the rest of the United States and the world.
We've had patients from around the world.
Absolutely. And that was another initiative that was important, kind of middle of the way of the program. The program has been around, guys, for 7 years. I'd say kind of middle of the way, we brought patients over from South America that did not have the means to receive treatment in their home countries, and we treated them for free. And they had great results, and they were ecstatic to receive that care. But our mentality was always to kind of take care of people across the board and do the best that we could to do that without any restrictions. We always wanted to offer more and more for the care. And another thing, I guess, that happened during our program, which is very challenging for most folks and has been for most businesses and most entrepreneurs, was COVID.
Yeah.
COVID happened as a program became a comprehensive stroke center. We started doing cases, and about a year later, or even less than that, about a year later, COVID happened. Everything was shut down.
We were on a very vertical climb.
Vertical and restricted climb,
That's
yes.
right. With everything. And COVID, it kind of stopped us for a little bit, but it also let us catch a breath. And because I don't think, because we were looking to expand the staff even more, knowing because that one of the ways I personally was able to be on call so much,
right,
is because we were building a program. So initially, you're not getting called in every day. You're not staying late and doing things every day.
Right.
you are doing it, gradually. And as you see things increase,
right,
is where, you can, you're like, okay, we need to start making changes.
right,
Because the volume's going up. The volume's going up. And then COVID kind of kept us stagnant, but then we were able to and once again, administration was on our side, and they said, we're with you.
right.
And once we got out of COVID and the volume picked up it didn't pick right back up. It doubled from
Right.
where we were
Right.
prior to that immediately. They said, they were on board with expanding everything.
Right, and I think COVID also gave us the opportunity to push on more for research, education, do a lot of the other things that we wanted to do and didn't have the time, of course, as we're building a program. So it wasn't the worst thing for us in terms of our growth.
From
I
a
think,
business aspect.
yeah, to some extent, it gave us oxygen to, be able to start again very strong, and of course we never really stopped entirely because stroke is an emergent and brain aneurysm ruptures. Yeah. Those are emergent diseases that really do not stop, no matter what, if there's a pandemic or anything else, and so COVID happened. Of course, then we were able to come back a lot stronger, and then establish ourselves and recruit more people, recruit more staff, create a very strong community now inside the hospital in favor of stroke. And then bring another interventionalist, Dr. Marisfoy. So 3 of us, and he will be also in. Actually, he is. You guys probably would have already seen him in an episode of the podcast, but he'll be also in future episodes. So all these folks really helped us get where we are today. In a very mature program now. Very well established with phenomenal results, great reputation in the community, and really one of the shining stars of the community and of Good Samaritan University Hospital. And to that aspect, like you said, that's what gave birth to the podcast, because now, we want to bring that experience and that knowledge and that education out there and get other people involved.
Because we get so many questions when we were doing our community outreach, or even other physicians have asked you, because neurosurgery is kind of a small in the community.
Right.
That's why you and Dr. Ahmad had, they even talked about what do you do in residency when you're interested, because you get so much, but you it's better just to put it out there, and then and make it accessible to everybody, even if they don't know that you exist. Now they have your your advice.
Right. So it's been a great journey, and for as far as I'm concerned, I'm looking forward to the rest of it. Of course, we've celebrated 5 years 2 years ago. Hopefully, we'll be celebrating 10 years in a couple more years in the future. And then where is this going to go? Right. That is the thing that is on our mind. It's always been. I think we've always been looking at the future while making sure the present is very strong, right? And so where do you see this thing going? Of course, I have some thoughts of my own, which I'll share. But where do you think this thing will go?
We definitely are expanding, and I think that we are, we're growing faster than is capable from an infrastructure point, because things take time.
Right.
We are getting a second room for that's been in the works.
Right.
But it takes time. It's construction. It's moving things around. There's a lot to go into that. So that's been on the horizon, and I think I see us expanding throughout Long Island, not just at Good Samaritan Hospital.
Right. I think that's exactly right. Definitely infrastructure is a big thing for us. And a lot of you, if you're from Long Island or the South Shore of Long Island, you will know that Good Samaritan University Hospital is going through a large modernization project. And in that modernization project, there is a $500 million facility that's being built in front of the hospital, where actually we're going to have a biplane room, a room like what we do our procedures in. But we're also building another room adjacent to the one where we are right now. So in total, there'll be 3 rooms to accommodate the volume of cases and the interventionalists that are doing those procedures. Our neuro ICU is going to expand. Our neuro step-down is going to expand. And we will likely have a whole floor of neuro patients in the very near foreseeable future. And hopefully we'll be able to offer this service. Of course, we've been working under a hub and spoke model where we have Good Samaritan Hospital as a comprehensive stroke center, a tertiary referral center, receiving those patients from multiple other hospitals. But we're also considering having this service available in other hospitals, in Nassau possibly, and growing that footprint in the community. And, we know how to do it, and we'll do it again, and we'll do it successfully. But, like I said, I couldn't be grateful. I mean, if I can, just before we close, enter a personal plug, it's not just to say it, but really none of this would have been possible without everybody else doing the work. Of course, to some extent, I was the cheerleader, cheering everybody on and kind of maybe even giving the vision to some extent and getting people to buy in on that vision. Everybody from the CEO of the health system all the way to the security guard in the front that needs to know everything about stroke when the Joint Commission shows up. So to get everybody to buy in was what I needed to do, and luckily I had that ability and that talent to do it. But really the work was done by everybody else, and it's been a success without question, and I'm very proud of the work that everybody put in, and especially you. You've been around since there was a hole in the ground that I made sure not to fall in.
That's true, yeah. And then there's a video where you almost fell in it. I've seen it. It's kind of B-roll. But yeah, another thing with everybody that came and not necessarily came from another state or anything like that, because people in our department we work with now left their positions to try something new.
Right.
I remember we interviewed some people over the phone, and we didn't even know them at all.
Right.
And we're like, we didn't know if we were just getting dumped on by people, or if people were volunteering, or if it was a draft, so to speak.
Right.
But when people come to something like this, it's important. I'll use Karen as an example.
Right.
Because she was on Long Island.
Right.
But she came from a different hospital.
Right.
But think about, you have to have an open mind as to what your role is going to be, and what you're going to do, because when you start something, it might be one thing, and it's going to quickly change into another thing.
Right.
And to be able to adapt and roll with it is so important, and that's a testament to the people that we have surrounding us.
Absolutely. Well, yeah, we thank the people that made this happen. We thank the amazing team, and of course, we're looking forward to a lot more years of changing our community and hopefully being of value for them.
Thank you guys for having us, so to speak.
Absolutely.
And supporting us.
Well, again, thank you guys for listening in. Don't forget, of course, to like and subscribe on our YouTube channel. And we will see you again on another episode of Brain Buzz. Thank you.